Thank you. Thank you for that introduction. Okay. Thank you so much for having me today. I'm so excited to be here and to be in this environment with all of you. It's new to me, and so this is very awesome. With the proliferation of information and communication technology, using the internet to seek information is a prevalent behavior around the world. A 2020 survey conducted by Eurostat shows that 55% of Europeans aged 16 to 74 have looked for health information online. That's a 21% increase since 2020 or 2010. In other countries like Finland, Netherlands, Denmark, and Germany, that number has increased to be 70% of the population. Here's a source for you if you would like to look at that. According to the Pew Research Center, the percentage in the United States is similar. In some Asian countries, the percentage is closer to 80%, like in the Philippines, or 85% like in Hong Kong and Indonesia, according to a study by Wang Shi and Kong, published in Health Communication. Seeking health information online allows consumers to obtain knowledge about their health problem and make health decisions and change their health behaviors. Last year in healthcare, an article written by Jia Peng and Liu titled Online Health Information Seeking Behavior described a systematic review of work done in the area. The authors report that 83% of health information consumers searched online using a general search engine like Google or Yahoo. Many consumers reported looking for health information on social media platforms, user-generated online health information, sites like Quora or Reddit. Jia Peng and Liu also found that the health topics consumers searched for vary. The most popular search topics, though, include diet, nutrition, exercise and fitness, and certain health diseases. Topics might include information about health treatments, mental health issues, and sexual or reproductive health information. This reflects data previously reported by the Pew Research Center. We don't need a slide to tell us that consumers are on social media. Social media is ubiquitous with everyday life. Can we even accomplish our day without social media or without using information technology? How often do you check your email on your cell phone or use GPS to find your way? Or start a load of clothes in your washing machine with the Samsung app? Did you know that's a thing now? How often do you use social media for clients or just for keeping in touch with family members or friends? In Colorado, we're still using the QR codes at restaurants. Remember when that idea, when first launched, didn't become popular initially in 1994, or even when it was rebooted in 2011? And now in 2023, after the COVID pandemic, QR codes are here to stay for a while. Everything is moving to our phones and online. According to the Pew Research Center in a report from 2021 on social media use, Americans are online and on social media sites for like Facebook and Instagram. That number increases as age decreases, which is on track with previous research conducted by Pew Research Center. The growth seen across individual sites and apps has remained steady for sites like LinkedIn, WhatsApp, Twitter, and Facebook. What is interesting, though, is that sites like YouTube and Reddit both saw statistically significant growth since 2019, when the last Pew Research Center survey was conducted. Instagram, TikTok, and Snapchat are the most popular among young adults ages 18 to 29. Survey participants report visiting these sites at least once per day, and more than half say they visit several times per day. Survey participants report visiting these sites multiple times per day. And you know, I'm a college professor, and I can say it's many, many times a day. My students spend hours on these platforms. Not long ago, Paris Hilton and Kim Kardashian were vying for coverage on entertainment news sites and in weekly gossip magazines. It was common to hear that these influencers were famous for nothing. But skip to today, and social media influencers are a common practice in marketing communication. Addison Rae, for instance, is a, yes, Addison Rae, for instance, is a 21-year-old TikTok influencer. Last year, she made the Forbes 30 Under 30 list for social media influencers. According to TikTok, she has over 87 million followers, which makes her the fourth most followed person on the platform. Forbes reported that Addison Rae earned $5 million in 2020 by means of endorsements with brands such as Reebok, L'Oreal, Hollister, and American Eagle. A recent report by eMarketer noted that consumer response is highest when messages are delivered from social media influencers compared to brand-owned channels. Since this is a relatively new marketing strategy, academics are still debating on the industry practice and its related definition. So here are a few definitions I pulled from the literature. When studying the effects of social media influencers, it has been found that consumers have stronger connectedness toward them and they perceive them as more authentic. I hope y'all can see the definitions of the influencers on my slide. I didn't put them here, and so I'm sorry for that if it's not on my slide. The perceived realness of influencers. Okay, thank you so much. I will, I'll get those definitions out maybe later for y'all to see. There's no agreed upon definition is really the key here, is that academics use different types of definitions to define followers or define influencers, but really number of followers, active engagement are the true definers, if you will, of how marketers look at the value of influencers. Thank you so much. Sorry about that, y'all. The brands of these influencers are perceived as real and relatable, so these influencers become approachable and they're compelling for others to imitate. These two definitions are almost conceptually identical and share the following: large number of followers, active engagement, and promotion of products or brands. That's how we think of and define an influencer. Influencer Marketing Hub conducts an annual survey about influencer marketing since 2017. They monitor the state of the industry. The market grew from $1.7 billion in 2016 to $9.7 billion in 2020. In 2021, influencer marketing soared to $13.8 billion and is supposed to reach $16.4 this year. The growth is attributed to the increasing popularity or short video formats like TikTok or Instagram Reels. Social media platforms are viable avenues for consumers to learn about new products and services. Instagram, for example, is a popular platform for influencers and has a wide global reach. 83% of users report using the app to find something new. After seeing posts with product information on Instagram, 87% took a specific action, like following a brand, visiting a retail store, or making a purchase. According to the Digital Marketing Institute, 49% of consumers depend on influencer recommendations, and 82% trust the opinions they see on social media channels that they share with family, friends, and influencers, and then they use these comments to drive purchase decisions. Consumers don't trust pharmaceutical companies, period. That sentiment of distrust has prevailed among consumers for decades, not just in recent times related to the COVID vaccine. Trust is a complicated matter in prescription drugs, especially when the majority of Americans are dependent on them. Almost half of all Americans take at least one prescription drug, the CDC reported in 2020. The legalization of direct-to-consumer marketing has permitted pharmaceutical companies to engage directly with patients. Direct-to-consumer marketing is the promotion of pharmaceutical or prescription drugs directly to consumers as patients instead of targeting only doctors and physicians. Medical marketing reached $30 billion in 2016, and that was up from $18 billion in 1997. This is from an article in the Journal of the American Medical Association by Willis and Schwartz, published in 2019. Much of this money that is spent on direct-to-consumer marketing is focused on disease awareness advertising. Pew Research Center in 2009 reported that more than 77% of patients use search engines to learn about prescription drugs that treat specific conditions. This presents pharmaceutical companies the opportunity to communicate with patients online. Documented scholarship notes that recent direct-to-consumer marketing efforts by pharmaceutical companies have focused on digital advertising and engagement tactics to connect with patients and build these relationships. We won't spend too long here, but I just want to do a quick stopover to note that since the legalization of direct-to-consumer advertising in the United States in 1985, a debate has unfolded with experts arguing about the benefits and consequences of this type of marketing communication. For decades, pharmaceutical companies have modified direct-to-consumer strategies, even being early adopters of digital communication platforms. Proponents of direct-to-consumer advertising say that ads are a legitimate source of quality patient information and a way to increase patients' health literacy. Arguments against direct-to-consumer advertising center on concerns about the pharmaceutical industry's ability to produce unbiased information. Given the nature of market economics, the primary aim of direct-to-consumer advertising is to increase market share and profit rather than enhance patient well-being. In June of 2014, the Food and Drug Administration, or the FDA, issued guidance for industry on how to use social media platforms. There has not been any further updates to this guidance, to my knowledge, to date. The Federal Trade Commission, the FTC, in June 2022, proposed changes to its guides concerning the use of endorsements and testimonials in advertising. And so the FTC applies to social media influencers, and the FDA applies to pharmaceutical social media advertising. This relates to disclosures and endorsements by influencers. And so now let's talk about patient influencers, which is really why we're here today. It was in a Vox article in 2019 that initially piqued my interest in the topic of patient influencers. This term was used in that article. And so I reached out to a friend at an ad agency to say, are pharmaceutical companies really working with patients? And he confirmed that indeed patient influencers are working with pharmaceutical companies. And now many of you might already know what that is, and maybe you are a patient influencer yourself, and I'm the one who is late to the dinner party. But there's no information on patient influencers, very little. There's none in the academic literature, and there's none in industry publications from ad agencies, pharmaceutical companies. Just very little is known about patient influencers. And, excuse me. And so to explore this topic, my team and I conducted in-depth interviews with patient influencers. And so our question first became, how do we even recruit patient influencers? Where do you find them? How do you do it in a scientific way? And so when we defined a patient influencer, we had to think about who are they and who are we wanting to interview for our research. And so we define them as someone who has a homogeneous following in a specific drug disease category. A disease category is kind of like a brand category. And so a homogeneous following is those with that same disease or illness or a caretaker interested in that topic. Health Union is a marketing agency who works as an intermediary between pharmaceutical brands or medical devices and other brands and patients. And so we wanted our research to be reliable, so we wanted to partner with Health Union, and we used them as a jumping off point. We asked for a list of influencers who might be interested in participating in our study. And since nothing's been published, it was just an exploratory study. So they gave us a list, and we used that initial list to conduct our interviews. And we did snowball sampling. So what that is when we interviewed a patient influencer, we then asked for a referral. And so yes, some of them were all in network, Health Union's network, but we also interviewed beyond that scope. Each participant interviewed for about an hour, and we paid $50 for their time. The inclusion criteria was that participants had to be at least 18 years old, have a social media following of more than 1,000, and participants that we recruited had a wide range of illness and disease, from HIV/AIDS to fibromyalgia to prostate cancer. In total, we conducted 37 interviews by phone or through Zoom that averaged about 87 minutes in length. Interviews were recorded and transcribed, and they have been analyzed already. As I'm talking to you, I'm going to present some of our results. I have some other results under review at different journals and conferences, so I'm very excited about this topic. But here's some findings for us from our interviews. So ultimately, it was said time and time again by these patient influencers that patients are interested in other patients' experiences. Being able to see how life looks while living with, for example, fibromyalgia, allows patients to evaluate their own selves and what their future prognosis might look like. Some of the participants started their social media platforms with the intention of being an influencer. To them, that meant sharing about living their life with the disease to show others what it might look like, and then allow others to ask questions or engage with them as patients. When we use the term influencer, many people think Kylie Jenner, Kim Kardashian, and many of the people we interviewed, they didn't like that term. They felt that it had a negative connotation despite it describing some of their work. Kylie Jenner and Kim Kardashian are mega influencers. They have millions of followers, and they're very costly and difficult to secure. In contrast, a patient influencer is most likely a micro or nano influencer, meaning they have a smaller following, but like we talked about earlier, most of their following are patients with the same illness or condition. participants that we interviewed for the study, they had less than 20,000 followers. So we were talking about micro or nano influencers here. But again, like I said, what's special about these patient influencers is a lot of their following has the same illness or disease. So they're actually providing a direct avenue for health communication and health education, if you will. That's what you would say if you worked in public health. But if you worked in marketing, that is not what you would say. There was a debate from the participants about the word patient influencer. Is that even an appropriate term? Or is patient advocate better to describe the work that they do? While only a few of the patient influencers participated in our study, 37, there are hundreds, if not thousands, millions of patients who are sharing their stories on social media. The participants in our study reported using hashtags so that their content could easily be found by others who might be searching for information. A lot of the patient influencers we interviewed for this study either currently worked or have worked with pharmaceutical companies in some way. That might be speaking at an event, participating in a focus group, serving on a patient panel, etc. In a few instances, patients worked with a pharmaceutical company and posted social media content promoting a specific brand or raising disease awareness. In other instances, participants felt it was inappropriate for patient influencers to work with pharmaceutical companies or even to discuss prescription medications with other patients online. It was common for patient influencers to say they wanted to help others avoid the same experience that they had had when they were first diagnosed because it was so bad. Many reported there was a lack of information, especially people of color. There was a lack of culturally appropriate health information. Many influencers felt it was their calling to help others, or at least to empower other patients to take care of their own health. All of the patient influencers were motivated by helping others and being a source of reliable health information. Pharmaceutical companies then identify these patient influencers and leverage their patient journey or their lived experience to build trust with patient populations. The findings this slide refers to is about health literacy and how influencers communicate about prescription medication on social media. It was agreed among the sample that drug information should only be shared if the patient influencer has direct experience with the specific medication that is being talked about. When patient influencers communicated about a particular medication, it was usually related to side effects they experienced or how it worked for them. Patient influencers spoke to other patients as experts in disease management after having lived with their condition for a long time. Often, patients are seeking other patients' experience and knowledge. Pharmaceutical companies collaborate with patient influencers for that specialized knowledge, but also for their influence on their community of followers. The patient influencers who did share their experiences with pharmaceutical medications, they agreed that transparency was key. They did not want to work with a pharmaceutical company if their messaging would be restricted in any way. The patient influencers wanted to be an accurate, trustworthy source for their followers and did not ever want to mislead other patients. Many of the patient influencers interviewed conducted research on their own disease or topics related to their disease, like new pharmaceutical medications or research trials. Patient influencers wanted to share this type of information so that other patients could become educated and make positive health decisions. Followers develop an emotional connection through the influencer's shared content. A lot of the patient influencers receive training about the federal regulations related to pharmaceutical drugs. This is actually a service now provided by Health Union when they work with patient influencers. Despite having different approaches to discussing pharmaceutical medications online, the patient influencers that we interviewed all deferred to physicians telling followers that they should speak with their doctor. Depending on the disease or condition, there is a range of plausible treatments in different disease categories, and in others, there are no pharmaceutical options. Patient influencers' knowledge about pharmaceutical medications differ greatly, as does consumers. Unanimously, all patient influencers agreed that they would not give any medical advice, but instead prompt the patient to contact their physician with questions. In the interviews, it was heard repeatedly that the patient influencers wanted to help others be better patients, to take control of their health and their attitude, and to use information to advocate for what they need. The patient influencers discussed wanting to help other patients overcome their own challenges and to, quote, to live a good life with this disease. All of the patient influencers wanted to help their followers and to raise awareness about their disease or the condition. Despite enduring many health challenges, these patient influencers express self-efficacy, which is like self-confidence, to engage in self-management and to quote, take care of my health. By sharing their successes, patient influencers may be increasing their followers' self-efficacy to practice self-management, including medication adherence. And so now, my colleague Daniel G. Garza, who's also a patient influencer, is going to speak to y'all.
Hello, everybody. I'm making my way over to the podium. I am still new. Here we are. Hello, everybody. If somebody can give me a sound check, if you can hear me. Got it. Thank you. Hello, everybody. Again, my name is Daniel G. Garza. I'm so excited to be here. I was very nervous this morning, so nervous that I woke up at 4:30 to make sure that I was ready and I was going to be on time. But once I got here, I knew this was going to be an amazing experience because I saw a cat and a wolf in the audience, and I've never done a presentation where there's a cat and a wolf. So this is really cool for me. This is definitely going on the top 3 best presentations that I've ever done. For everybody, I am a Health Union ambassador. I've been with them for several years now, I think about 5 or 6 years. And originally I started as an HIV, a person living with HIV, and that was my advocacy work. And then over the years, I've added anal cancer. I live with an ostomy, and I was diagnosed in 2018 with PTSD due to health issues, which is something that I never even knew existed. I didn't know that there was such a thing related to health issues. But once I was diagnosed, I understood what was going on with me so much better. So I'm going to talk to you today, as you can see on the slide, 3 topics: advocates versus influencers, stigma and culture, and social norms and prevention. And I promise to keep it short so that we have time for question and answers. Um, Erin did such a great job with the information, and I was one of the people that she got to interview, and that's how we got to know each other. And I think her and I stayed on the line for like 2 hours when she interviewed me, but it was really great to be part of the study. And please follow her and go check it out. So, starting off, advocate versus influencer. And just to give you the definition so we're all on the same page, advocate is a person who actively supports and promotes the interests of another person. And an influencer is someone who can persuade a large group of people to do, buy, or use the same things that they do. For me as an advocate, I get to represent people in the HIV, anal cancer, and ostomy community. In fact, this year I became the ostomy champion for the United Ostomy Association of America. So I'm the face of ostomies for the next year, as well as those affected by PTSD due to health issues. My job is to speak to healthcare professionals, policymakers, and lawmakers that work with the community to tell them about the needs of the community. To help the community, I get to share my story. I get to be vulnerable, just like Joseph did earlier. I get to ask them to do better for the community. I have the responsibility to reflect the image of the community I am serving. And let me tell you, sometimes that can get a little confusing to go between HIV, anal cancer, and ostomies. Then I go back to the community and I share what I have learned. I create workshops, collaborate with other organizations, and gather more information. And then the cycle has to start all over again because sometimes there's issues with funding, medications, policies, laws. It is so fulfilling to be able to use my diagnosis and condition as fuel to push me to follow my passion, help others, and give my life purpose. Because there was a time when I was first diagnosed with AIDS that I thought, this is it, this is the end of my life. When I could sit back and feel sorry for myself, I choose to take my situation and make a career out of it. I get to be an influencer as well with my production company, Lilmesican Productions, Inc. It's a social enterprise. So we create shows that reflect the community that we live in. And my partner, Christian, and I uh, both belong to the Latinx community, the LGBTQIA community, and those with health conditions. Through our main show, which is the Christian and Daniel show, please go watch it Wednesday nights. We can talk about businesses, projects, or events that are of interest to us in our community. We can help shape our community while entertaining, educating, and energizing our viewers. And as an influencer in the community, I am responsible for making sure that I do my homework. It's easy to pass along information that can harm the community. And I have to be really careful about that. Sometimes the advocate and the influencer have to work together to make sure that they are providing the best information, work on building up the community, and we hold each other accountable. So the advocate in me has to hold the influencer in me accountable for the products he's promoting, and then the influencer has to hold the advocate accountable to make sure that it's doing the right job and speaking the truth. I'm going to talk to you about stigma in culture. Stigma is let me define that. Stigma is a negative attitude, prejudice, or false belief associated with specific traits, circumstances, or health. Stigma in culture varies depending on the group that I'm representing. And as I mentioned earlier, there's so many groups that I'm part of, so many boxes that I check off. I'm part of the HIV, cancer, and mental health, and those carry different degrees of stigma. I am gay, Latino, and I'm an immigrant, and those carry other levels of stigma. So alone, each one can be hard, but when you start combining them, it gets really difficult. It's like combining Play-Doh and then trying to separate the colors. When I was starting my career, it was suggested that I work on my accent. This is one of the stigmas. They said I went to business school and they told me if you're going to be working in the corporate world, it would be easier if you did not have such a strong accent. So I actually went to dictation school, and for weeks I did Shelly shells seashells by the seashore and Peter pickles. And anyway, so I did all of those for months to let go of the Latino accent that I had. I'll be honest, today, there's a part of me that regrets it, and there's a part of me that's proud of the work that I've done. As a gay man in the Latino community, there are certain cultural rules that must be followed to belong. Coming out came with assumptions that are integrated in my culture as a Latino man, and those could create more stigmas. I did not realize until I was diagnosed with cancer that even in health, there are levels of social acceptance. Like in my case, they range from like the most accepted to the least accepted: cancer, diabetes, ostomy, mental health, HIV. Cancer is more acceptable until I say anal cancer. Then that creates some looks and some comments. Colorectal cancer is more acceptable than anal. Breast cancer is more acceptable, but in the Latino community, any cancer conversation can be a cause for shame. So now I'm going to talk to you about social norms and prevention. Social norms, and the definition is: social norms are shared values, beliefs, attitudes, and behaviors that are considered acceptable in a particular social group or culture. These can become overwhelming when they work against you. I made a choice when I came out in 1988, I was 17, that I would not hide my identity or my sexuality. I was open about my HIV status when I was diagnosed in 2000 and about anal cancer in 2015, so much that I started a video diary the day that I was diagnosed. When Latino social norms dictated that I should keep those things to myself, keep them a secret and not act on them, I decided to walk away from the traditions that were normal in my community. When I decided to work in HIV advocacy, it was hard to break through the social norms to be able to talk about HIV and anal cancer prevention. Not everyone is ready or willing to listen and break through cultural and religious barriers. These are norms that have been held for generations, and I'll admit that even for me, it was hard when I was first diagnosed with AIDS. I thought it was a punishment from God, that the universe was making me pay for my past, that karma was coming to get me and make things even. I even had a lot of time to process and analyze my life while I was in the hospital. I was originally in the hospital for 3 weeks. And working through my issues has helped me to be a better advocate, an influencer, and a person. And I have experience in breaking through cultural, religious, and social norms and barriers. And that is my part. Thank you so much for listening. Oh, yes, and I'm sorry, back to Erin.
Thank you so much. I will get back here. And in order to stay on time and have room for questions, I will move it along. Okay, so basically, Daniel's experience highlights reflective of many of our patient influencers that we interviewed, all wanting to advocate and help their community. And so this is a new strategy used by pharmaceutical companies, and there's so little known about the practice. More research needs to be done, so I hope other researchers will jump on this topic so we can learn more. There's no up-to-date regulation on this, and obviously no one, pharmaceutical companies, advertising agencies, patients, no one wants to get in trouble. But it would be great if the FDA and FTC could update some guidance on new platform functions like Instagram stories. And then perhaps ad agencies, I think, could lead the way in creating best practices that guide professional behavior. Patients, some, as y'all know, have limited income and limited opportunities. And so this is a vulnerable population. So we should make sure that they're not being taken advantage of by ad agencies or pharmaceutical companies. And so more needs to be done about what's happening. There's a lot of secrecy around this practice, and part of it is advertising strategy. It's smart how companies are doing this, and so that's why no one's talking about it, is because it's working. It's a new practice, and so more work needs to be done about it. And so it does breed suspicion. When I'm called by journalists, they're often wanting to, uncover something that's being done that's illegal, but in my interviews, nothing's being done that's illegal, but more transparency needs to happen around the issue. Health Union is a very successful company that connects patients with these opportunities, and they're actually leaders in the space. They've just created a new training around direct messages, asking that their patient influencers I think turn off their direct messaging. So that's a new thing that they're doing. And so patient influencers really are in some way an interactive direct-to-consumer ad, just with less regulation. And so I personally think that patients have a lot of potential. This could be a health education space, less about marketing, more about living well with the disease. And so I'm going to skip through here. And so we'll skip down to the end so we can take y'all's questions. This is really the idea that there's so many of these patient influencers, and patients are seeking out information. We need to do more work in this area. Okay, Daniel, I'm just skipping down to the end to get to that last slide. Here y'all go. Thank you so much for letting us speak to y'all about this. It's a great topic, one that both Daniel and I are very passionate about. So if you guys have any questions, we'd love to talk about it.
We have a question from Mook. You said that not one participant was motivated to be a patient influencer because of money or financial gain. Did you find that this tendency changed or distorted with time, or increase in influencer follower numbers? Social media monetization, endorsements, and corporate product freebies in return for mentions is now an entrenched reality of social media. But because patient influencers deal with people's health and treatments, this is obviously concerning. I do understand that the snowball sampling would bear upon your findings.
Great question. Thank you so much for this question. So what I think is interesting is there's a few things that is making this such a difficult conversation, because if you go look at Daniel's Instagram page, for example, and you really follow Daniel G. Garza and what he's doing, he's what I think is a patient influencer or a patient advocate. But there are other people who are doing more influencing than advocating. And so while the people we interviewed did not, want, like, money is always good, right? Opportunity and money, it feels good to make money, but some patients were under, they couldn't make money based on their financial situation, or they relied on the pharmaceutical relationship to survive. And so it does get very gray in this area. But I do think that as more opportunity exists, I think you will see more patients try to, get those opportunities. And so it's just kind of a slippery slope. I hope that answered your question.
And Mook says yes, and she agrees that it is a very gray area. So Gentle has a question for Daniel. Your part of the presentation was so powerful. What advice would you give to people who are thinking of becoming an advocate or influencer? You showed us that it takes courage.
Yes, hi, very, very good question. What advice would I give to somebody who's thinking about becoming an advocate or influencer? Number one, be mentally, physically, and spiritually ready. It takes a lot of mental power to know how to work through information. Uh, Physically, it's very demanding. There's a lot of stress that comes with being an advocate. Uh, there's a lot of stress with being an influencer too, because you have to do a lot of homework. Uh, Sometimes there's been times when I've put out information or been at a presentation and either like today woke up 3 hours before because I was so nervous, or I stay up at nights thinking, did I do the right thing? Did I say the right thing? Am I representing my community the right way? And then spiritually, because it's going to be out there, your diagnosis, your condition, your illness is about to be public knowledge. There was a lot of conversations with my family about it, particularly when I was diagnosed with AIDS. So to clarify, I was diagnosed with AIDS, but my numbers put me at an HIV level now. But there was conversations to be had. I had people to consider. Um, so I would say sit down, have a really honest conversation with yourself and ask yourself, am I ready to take this journey? Um, because once, we all know social media, once it's out there, it's out there. There is no taking it back. So sit down, have an honest conversation, and check mark mental, physical, and spiritual. And if you say yes to all three, then move forward. I hope that helps.
Pecos asks, do you know if any courts have started to determine liability responsibility for influencers advocates who provide incorrect or damaging advice?
Y'all have such great questions. I actually don't know. We know of, so a lot of people will refer to the famous Kim Kardashian example where she promoted a medication for morning sickness, and she did not include that it wasn't a sponsored advertisement. And so people will use that as an example. And she was fined, but the fine, was laughable really when a celebrity like that is fined $10,000 or whatever the fine was. But that's really the only famous example. And so Daniel might actually know of an example, but I don't know of one.
I don't, like Erin was saying, sometimes they go under the radar, or they're so minimal that there's no real consequences. Uh, I'm, I know that in the beginning for HIV, if you have watched HIV commercials, the medications, they used to use actors to represent patients. And several years ago, they started using actual advocates, patient advocates, who were people living with HIV to do the commercials so that there could be, uh, I guess, more transparency in the information. In fact, some of my friends are in those commercials, so it's very exciting to see actual people living with HIV in HIV medication commercials.
Peko says thanks, and Mook comments that regulation and enforcement of social media influencers would take massive rewriting of current legislation, I imagine. Hunter says here some have been fined for COVID misinformation.
I think this area is only going to grow with misinformation as people see that it could be financially lucrative. That's really the real worry, right? Is in our sample, the 37 people we interviewed, none of them would discuss a drug that they have not taken or promote a drug that they have not taken. But that's 37 patients. And so I think as this area grows, there's going to be more people flood the space. And that's one of the things some of the influencers talked about is there's a growing feeling of competition within the space, because there's only so many opportunities, and influencers or these patients want those opportunities, some of them. And so I think that that's going to complicate matters only further, which is why I'm an advocate for more regulation or, best practices from ad agencies, just an agreement of some kind. One patient talked about a need for standardization of pay, which was kind of interesting, because if you don't know how to negotiate that contract, you could be definitely doing work for less money. And so lots of things to think about if you go into this area. I see a question from Faith, and I don't know if I can just jump in and answer the question.
Yes.
Okay, great. So knowing the past history of the drug companies, how can we trust influencers? So this is where I, during my interviews and meeting people like Daniel, these people are doing such good work, and they're putting their, mind, body, and soul into it, and really trying to help communities. And so Faith's question about trusting influencers is, tricky, because there's people you can't trust out there trying to give misinformation, maybe not purposefully, but maybe also purposefully. And so I think patients have to really do their homework and make sure they're double checking the information they're getting. And so one of the things when reporters call is putting a negative light on patient influencers, but I think quite the opposite. I think the ones we interviewed are truly making things better for other patients. It's just separating those good influencers from the ones with, only financial motives, maybe.
Could I add to what you just said, Erin?
Please.
Yeah. So first of all, I'm watching on YouTube on my TV, and my avatar looks so mysterious and moody. It's supposed to be a vampire, so let's go with that, folks. Because he keeps crossing his arms. He's not bored. He's just paying a lot of attention. But one of the things that I've learned as an influencer, and one of the things that turns me off when people say, trust me. So I'm not going to say trust me. I'm going to say that anything that I promote on any of my social media pages, or that we promote on the Christian and Daniel show, uh, are things that we've tried, are things that we've done. When it comes to medications, they're medications that we've been on or we are on currently. And me personally, I shy away talking about medications uh, because everybody's different, and that's something that you should talk to your doctor about. But if it's something that I have personally been through or going through, then I will tell folks this is my story with that product or that people or that place. Uh, but yes, if you ever hear me say, trust me, run away, I'm probably not telling you the truth. And that's a joke, folks, by the way.
Thank you guys so much
Yeah.
again for inviting us. I echo Daniel. This is very cool, and this will remain with me forever. So thank you so much for this opportunity.